There are several causes for gallstone. However, the most common is the imbalance of the chemical that makes up the bile. The bile is a fluid that is produced by the liver, and it flows down through the bile ducts, and it's stored into the gallbladder, which is a small digestive organ. This is attached to the liver. It is unclear why there is this imbalance of chemicals. However, most of the cause, this imbalance results in an excess of cholesterol, which forms small crystals that after a period of time, sometimes years, forms proper stones inside the gallbladder. In some patients, they can be dozens of stones. In other patients, can be a single stone. So the first thing to know is that in the vast majority of patients, gallstones do not create any problem and they don't give any symptoms, sometimes for the entire life of an individual with gallstone. However, if they do give symptoms, these symptoms can vary for severity and type of symptoms. The most common symptoms are pain and indigestion usually. The pain is most commonly in the epigastrium, which is the upper part of the tummy. And also it's very common underneath the right rib cage, okay? The pain tends to radiate to the right shoulder blade and sometimes to the back of the patient. In fact, occasionally, some patients present with back pain, central in the middle of the back. As I mentioned before, there are a lot of patients who do have gallstone and have no symptoms whatsoever. In those patients, there isn't an indication to treat gallstone. The indication to treat gallstone is when gallstone become a symptomatic disease. And in that case, it is advisable to treat gallstone. The reason why is because once you had one or more symptoms of gallstone, it's very likely that at some stage during your lifetime, they will come back. When and how these symptoms are going to come back is difficult to predict. We know that the natural history of gallstone suggests that once you had one episode, it's very likely that the interval between the following episode will be closer and closer as the time passes by. The most common treatment is nowadays with an operation called laparoscopic cholecystectomy. Laparoscopic is also called keyhole or minimal invasive surgery, and it's consistent of 3, 4, or sometimes occasionally 5 small cut into your tummy. Through these cuts, some small instruments are introduced in order to remove the gallbladder. It's one of the most common operations performed on the abdomen, and it is most often performed as a day case. Day case means the patient come in the morning and they go home the same night. It's a very safe operation without any significant risk around at the time of the surgery. And also, equally important, removing the gallbladder doesn't have significant effect on the life of a patient afterwards.